Hello and welcome to the virtual version of the Autism Awareness Raising course delivered by Derbyshire County's new Autism Information and Advice Service. This course is for employees and volunteers working in statutory roles in Derbyshire County's adult health and social care sectors. A PowerPoint slideshow is being produced to go along with this course. This should have been shared with you when you were given the link to this video. However, if you do not have this, please do not worry, as I'll be reading from this course today and you can request it at a later date. In addition to this, I kindly remind you to record your completion of this virtual training with your relevant line manager, as a course attendance certificate will be sent to you, as well as an I Am Autism Aware lanyard to recognise the fact that you've completed this training and that you are now autism aware. This is part one. There are two videos for this training. Part one will cover the background of autism and explain what autism is, and part two will cover practical advice of how you can apply this in your role. I'm the service coordinator and I've produced this course to meet the following objectives. 1. To gain a basic working understanding of autism spectrum condition, neurodevelopment conditions and neurodiversity. 2. To understand the difference between ASC and learning difficulties. 3. To gain an understanding of the central three challenges of ASC, which are communication and language, social understanding and relationships, and impaired imaginative thought and inflexibility of thoughts and behaviours. And 4. To have knowledge of approaches to understanding and supporting these three challenges in your role. So, moving on, we're going to first look at autistic spectrum condition, neurodevelopment conditions and neurodiversity, and in particular the language we use when talking about these conditions. If you learn one thing today, I would like you to make it this. And it's if you have met one individual with autism, you have met one individual with autism. This is a common phrase now used in the study of autism, and it was developed by Dr. Stephen Shaw, an autism advocate and a person who identifies as being on the autism spectrum. It is really key to remember that when we talk about autism, we are talking very much in generalisations, and we are talking about a spectrum condition rather than a particular syndrome. What we mean by spectrum is that you can think of it like an umbrella or a rainbow, that there's a variety of severities or experiences within that spectrum, and that a person experiences all those things differently. So a person may have very minimal impairments in some areas and very severe impairments in others. They may only have one serious impairment, or they may have multiple. It's not a linear condition where we consider somebody really extreme or really minimal. We need to think of it more as an umbrella term, and that will become clearer as we go on throughout this training. So looking at the name, we use often the autistic spectrum condition as our phrase, or ASC, and it's just one term used to describe this developmental condition. It can also be referred to as Asperger's, which is often differentiated in the spectrum by a person who has specifically quite strong and good language skills. Autism spectrum disorder, so ASD, this is often used still within the medical community. Classical autism, high functioning autism, again very similar to Asperger's, so often used to refer to a person who feels few impairments. Canna autism, pathological demand avoidance. PDA is disputed as to whether it's in the spectrum, but I've included it here today as you may come across it and you are free to do some more research into this. And pervasive developmental disorder. Our service prefers to use the phrase ASC, so autism spectrum condition, and we also like to use person-centred language, so we like to say an individual living with autism spectrum condition. This is used in lots of areas now, so people often say an individual living with diabetes, an individual living with obesity, and what it does is it makes the phrase more person-centred and recognises that a person is more than just that condition. That condition is an aspect of their identity, but it is only one aspect. So instead it doesn't make a person sound like, oh well, they're just autistic, so an autistic person. Instead they're a person living with autism. Some people do see their autism as a key part of their identity, and again, the purpose of this training is to sort of educate you to follow a person with autism's lead, okay? If they wish to see autism as their key identifier, that's perfectly fine, that is how they wish to identify. And we use the phrase condition rather than disorder, as it's more commonly being used by the community itself, and the language seems to have more positive connotations. So the word disorder often carries with it the idea that there's something wrong with you, so people are now moving more towards condition as it sounds a bit more positive. Again, follow a person's lead as to how they identify and mirror their language. Okay, that's very important. Try not to use phrases that they don't identify as or that they don't see as recognising who they are. Follow what language they use. This course is aimed at people who don't have any knowledge of autism, so we're going to start at the very beginning and we're going to treat it as though the practical advice you get later on you've not heard before. So, what is autism then? Autism, or Autism Spectrum Condition, ASC, is a term used to describe a complex neurodevelopment condition that affects how a person experiences and understands the world around them. ASC, as I've already said, can be experienced vastly differently by different people, from being a minor impairment that they learn coping strategies to manage, to being a full disability that needs full-time care, possibly even in specialist facilities. So when we talk about ASC, it's important to understand we are often talking in generalisations, and the training you get today is just to give you a general understanding of autism. But as we'll talk about in the practical advice later on, you need to tailor it to each individual you work with. And we're looking just generally at the challenges faced on the whole by people living with autism. It is therefore important you prepare for a variety of severities and work in a person-centred and adaptable manner to meet the needs of individuals. There is no known single cause for autism, but it's widely accepted that it is caused by the brain developing differently in both structure and function. This is what we mean by a neurodevelopment condition. So it means that the brain is developed in a different manner to a neurotypical person. These are words we're going to look at in a moment. Scientific research is now looking at brain scans of children and adults living with autism, and they are now showing that the brains of these individuals are slightly different in shape, structure and volume to people who do not have autism. It's therefore becoming clear that the brain is developed in a different way when it comes to processing and distributing information. So to put it simply, autism occurs when there's a disruption in the development of the brain, which then permanently alters the way the brain is shaped and how it works for an individual. More significant research is being developed in this area to fully understand how this disruption occurs and what causes it, but for the purposes of this training today, we're just understanding it as a disruption that happens in the womb as a person develops with the brain and that the brain develops differently. It's also really important that we're using the word different here, because we're not to say that the brain is developed wrongly or incorrectly, it's simply developed differently. Autism is therefore a neurodevelopment condition, which means the nervous system is developed differently and thus impacts how the brain functions. The diversity of neurodevelopment conditions is vast and means that some people are left with a slight impairment, as I've already mentioned, which does not prevent them from leading an active and fulfilling independent life, whereas others may need lifelong assistance as they may not be able to walk or feed themselves. Some conditions may require early intervention during early years or childhood and enables a person to develop coping mechanisms to manage the challenges of their autism. We'll be looking at coping mechanisms shortly, as well as reasonable adjustments to be made by wider society, so in education settings or the workplace. Again, we'll be looking at reasonable adjustments shortly. So 2 key words you need to learn when we're talking about autism are the words neurodiverse and neurotypical. Neurodiverse is used to describe a person whose brain has developed differently, so somebody with autism. Neurotypical is used to describe a person whose brain has developed in a typical manner and does not have a neurodevelopment condition. So it's important that we use these words rather than saying somebody's brain has developed wrongly or incorrectly. It's just developed diversely. So neurodiverse for somebody with autism and neurotypical for somebody without. It's also important to understand that autism is not a learning difficulty. However, it does affect the way a person learns. So autism impacts the way a person understands and communicates with the world around them. Because of this, a person's learning is then affected, and reasonable adjustments by wider society are needed to ensure a person accesses learning in a manner that suits them. It is not right to assume that a person with autism has a learning difficulty or a learning disability. Sometimes a person with autism does, but they may not. So it is really important to get to know the person you're caring for or working with and to find out from them whether they have a learning disability or not. The term learning disability is a wide-ranging term covering a number of different problems with learning, and it impacts the way a person makes connections with different pieces of incoming information and when working to comprehend and organise that information in their own mind. Learning disabilities are also neurodevelopment conditions, as the brain has developed differently and affected their learning. So they can overlap sometimes in traits and characteristics with autism. Common learning disabilities often associated with autism are ADHD, ADD, dyslexia and dyspraxia. However, please do not assume that the person you're working with has these additional conditions. You need to speak with them and find out from them whether they require any additional learning support. So ASC is a condition that affects how a person perceives the world around them, and many aspects of everyday life become very challenging because of this. Things that neurotypical people take for granted actually are quite overwhelming for a person who is neurodiverse. If we consider everyday activities of food shopping, going to the cinema, meeting friends for drinks, getting on a train, flying on a plane, all these activities include navigating a series of unpredictable situations, interacting and communicating with lots of different people, and coping with a variety of competing sensory experiences. So let's take food shopping as our example. When you go to do the food shopping, you have to go into a completely new environment that's often maybe quite echoey, quite loud. You can hear people's steps, you can hear trolleys moving around, food being unloaded, people having discussions, maybe a radio, maybe music. There's quite harsh lighting. These are things that can be really overwhelming for a person with autism. They may be things that a person who's neurotypical doesn't notice or just assume, well, this is a supermarket environment. However, this can be really overwhelming. So lots of these environments often aren't accessible for people with autism, or they access them in a very limited way in a manner that they can actually cope with. So it's really important to understand that the social world is often overwhelming for a person with autism and actually can cause quite severe anxiety, but we'll look more at this in a moment. So I talked briefly about what reasonable adjustments means. Reasonable adjustments comes from the Equality Act 2010 and states that employees, service deliverers and education bodies must make practical and realistic changes to their recruitment processes, their environments and all their other processes and procedures to make sure any individuals with disabilities, physical or mental health conditions aren't disadvantaged when compared to a person without these conditions. So that's really important. We need to make sure that a person living with autism isn't disadvantaged sheerly by the fact that they have autism. So some examples of this could include allowing a person with social anxiety disorder to have their own desk rather than hot desking, or letting a student with learning difficulties complete an exam in a different manner, maybe with a scribe or a reader. Making physical changes to the workplace, like putting a ramp in for maybe somebody with a wheelchair, or changing the lighting in a room for somebody with autism. Letting a disabled person work in a different room or a different floor to suit their needs, or changing their equipment. So for example, letting a person maybe with carpal tunnel syndrome or arthritis have a special keyboard, or somebody with dyslexia having a coloured screen overlaying their computer. It is the law that people make these reasonable adjustments. If you're working with anybody that's currently trying to inquire about getting reasonable adjustments, I will direct you to our website where we have a letter template that you can complete on their behalf or with them that requests the reasonable adjustments they require. In terms of society then making changes, a person with autism also may have developed their own coping strategies. These are often started as a child with sort of social development advice or social interaction advice, but they can develop in sort of two ways. they can either develop as restrictive behaviours. So somebody might develop that if they struggle, for example, with their food shopping as our example, that they protect themselves from the stress of that by developing a rigid routine for it. So that they go shopping at one specific time a week, buy certain things and leave within a certain time. So developing these rigid routines and ritualistic behaviour is often a restrictive behaviour practice for a person to manage the stress that their autism or that the social world may cause them. And this can be quite successful. However, this obviously does get problematic when changes happen, but we'll talk about that shortly. And then also compensatory behaviours. So this is when a person is able to mask their autism in an attempt to fit in. So they want to be seen as neurotypical, so they mask their autism and act neurotypical in order to get on in society. This can be very successful, but it is also extremely mentally tiring and can be exhausting for a person, as it requires a lot of mental and physical effort for a person to do this. If a person becomes good at it as well, it can actually also delay them getting a diagnosis or delay them getting any reasonable adjustments. So it might be that if a person wants to do this, it could actually deny them the society making the changes that they require. And it is also can lead to anxiety and depression just because of the physical strain it puts on a person to act like they fit in. So moving on now to the 3 key challenges of a person experiences living with autism. There are lots of challenges, but on the whole, they are commonly broken down into 3 categories. The first one being communication and language, the second being social understanding and relationships, and the third being impaired imaginative thought and inflexibility in thoughts and behaviours. So these are generally the 3 categories that a person with autism may struggle with. So looking at the first one, I'll just give you a few examples of what this means. So communication and language. So interacting and communicating with others, particularly those outside of their close family circuit. So they may not be used to interacting with people, say, let's say in the supermarket, or strangers, or getting on the bus, or having somebody knock on their door. They may not be used to how that person speaks or how they need to communicate with them. In particular, a person with autism may struggle with judging the tempo, rhythm or pitch of speech of somebody they're not used to dealing with. For example, raising in pitch to indicate a question. This might not be something a person with autism recognises. So it's something, if you're new to working with somebody with autism, you need to make sure that your language is really clear to begin with until that person becomes used to interacting with you. It may also mean a person shuts down and doesn't really want to communicate with you. So those first meetings might be quite challenging. Also, there can often be problems in the areas of pragmatics, such as the appropriate use of language or conversation. So a person with autism may not follow the socially accepted manner of communicating in conversation. So the back and forth, so the idea you say something, somebody says something back, and so on in this rhythm. A person with autism may just say what they want to say and then walk away and end the conversation. And it's really important that we don't perceive this behaviour as being rude, aloof or uncaring. It's just that they may not be socially aware of what is acceptable in conversations. In the same vein, a person may ask inappropriate questions or use inappropriate language. Again, can often be perceived as a person being rude or unkind or so on, but actually it's just because they're not maybe aware of this being socially accepted. So again, please bear this in mind and take the time to work with somebody and build that relationship where maybe you might be able in the future to point out and help guide them in what is socially accepted. But more than anything, you need to be aware of this and not take it as them being unkind or uncaring. Again, understanding jokes, sarcasm, metaphors or anything abstract, this can also be problematic for people with autism. Quite often they think very literally or understand language quite literally. So it's important if you're giving examples of things, you do give concrete, clear examples, not something metaphorical or abstract. Integrating competing sensory experiences during a conversation. This can be problematic for neurotypical people as well, but for neurodiverse people it is even more challenging. So for example, if there's lots going on around you while you're talking, this can be really challenging to focus on the conversation or to express yourself. So if there's a lot of noise, somebody's touching you, there's smells, there's lights, this can really make it a challenging situation for a person with autism to hold a conversation and to focus on the conversation. Again, processing what's happening around them or understanding what's happening. If somebody's acting particularly different, they might not understand why a person's different. They might not understand that something going on in somebody's home might have made them act a bit different at work today. So again, it's just giving them the time to integrate new knowledge and to come to terms with anything that's happening around them and give them time to process that. Coping with change of routine or something expected. I briefly touched upon this earlier, but that can be very challenging for a person who's developed a very rigid structure. Or if, for example, in your setting, if they've got used to a certain carer, the carer's changed, that can be very problematic. Understanding and responding to the emotions of others or expressing their own emotions and feelings. This again can be very challenging. And moving on now with emotions into the social understanding and relationships, quite often a neurodiverse person or somebody with autism can give non-typical emotional responses or expressions or remain expressionless, or that they can't respond to facial expressions, and they can maybe appear to be insensitive, unkind or unresponsive. So for example, if you're not feeling particularly great and all you can do is maybe express that in a visual way with your face, a person with autism might not pick up on the fact that you're expressing how you feel just through your face. So it might be that you need to use specific, clear and directly say, I am upset today, rather than relying on a shrug or some facial expression. They can also have an under or overreaction to specific sensory stimuli or an extreme dislike or like of something. So this is very important to take into account when we look at touch. And I'll look at that in a moment with any practical advice that I'm going to offer for roles that do have to touch a person or require any form of sort of physical tests. And generally, a person with autism either responds with a meltdown or a shutdown. So a meltdown is where a person may become verbally aggressive, lash out, run away. It's where their physical response maybe becomes a bit risky or dangerous. Or a shutdown is when they will not make eye contact, not speak. So you need to be prepared for those situations and also help a person avoid getting into that situation, because that is very stressful for them. And you have to remember, in those situations, their behaviour is not something they are currently in control of because they are so distressed and anxious. So it's important to prepare for those times. I briefly touched on this reaction to physical touch. It's very important that you learn how the person you're working with prefers physical touch. That's in terms of the strength of the touch. Quite often firmer touch is preferred by people with autism rather than gentle touch. And also whether they've got any specific area of their bodies that are sensory triggers for them. We need to also be aware of any impact of past trauma, such as bullying or bad experiences with service providers or authority figures. So quite often people have had poor experiences with other charities or with other organisations or with schools. So that's something we need to be mindful of at all times and be aware of any past trauma and try to avoid any triggering or making the same mistakes again. And again, quite often people with autism also are living with anxiety or depression because of how challenging their autism may be. Thirdly now, we're on to limited imaginative thought and inflexibility in behaviours and thoughts. So it could be that a person with autism, one of their coping mechanisms, or because of the way their brain functions, develops an unusually strong or maybe obsessive interest in a specific topic, and that could manifest itself in that they're unwilling to talk about other things. So it could be that they repeatedly talk about one interest. Again, this is just something to be aware of and to either engage in that conversation with them or gently try and steer away from it if you do have something important you need to discuss. But this could be a way of bonding with a person with autism if they want to talk about a specific interest. So again, just be mindful and careful that this is their interest and there may be obsessive interest in it as part of their autism. The fact that they might have repetitive actions or behaviours, so this could be something like asking the same question over and over again, and this could be a manifestation of their anxiety. So if they are meeting you about something that's particularly problematic for them and you're their caregiver or you're sorting their issue out for them, they might keep asking you the same questions again. So it's about working to answer each time they ask that question maybe in a different way, or to say, okay, I'm going to give you the answers in a written form, just a way of making sure you get the information to them and also stopping the repetitive asking questions for them and to try and reduce their anxiety levels. And also if they have behaviours that are repetitive, like tapping or moving or so on, or some people may have some sort of facial tic, again, just be aware of that, not draw attention to that and let them manifest their anxiety or their autism in that way. It can also lead to restrictive eating habits. Some people with autism, because of their sensory needs, also restrict their food and drink. So that's something to be aware of if you're in a caregiving role. You need to learn what maybe types of food they can and cannot eat because of the sensory triggers. So sometimes people might not like soft, mushy food or might not like crunchy food. This is something you do need to learn. And quite often in women and girls, this is misdiagnosed as an eating disorder. So that's something to be aware of as well, and to keep an eye on a person's physical health, as if they've got restrictive eating habits because of their autism, they may need some help to introduce more foods into their diet or to manage the sensory experience of certain foods to make sure they've got good physical health. And then finally, that they need to develop a strict routine or the development of habitual ritualistic behaviour. It is important that this is a coping strategy. However, be alert to when these maybe become slightly risky. So if they start going into the area of having obsessive compulsive disorder and so on, and that the person might be putting themselves more at harm or self-harming because of this. So be aware of whether ritualistic behaviour is necessary as a coping strategy or whether it's becoming a bit too far, but you'll only learn that by getting to know a person. So if we consider all this, we can see how the social world is very difficult for a person with autism to navigate, and why it can be quite overwhelming, and how forming relationships with other people can be quite frustrating and difficult. So this is the end of the first part of our training today. Please feel free to just stretch your legs or reflect on the learning that we've done so far. And please join me for video 2, which is going to give practical advice on how you can actually support a person living with autism. Thank you.